So it seems like physicians have a lot of power in the healthcare system, but I would argue that they don't.
Dr. Amy Fan, welcome to PedChat. How are you doing
Thank
today?
you. I'm doing great. Thank you for having me.
So what did you want to be growing up?
So my parents always told me that I wanted to be whatever I saw. We went to the zoo. I wanted to be a tiger. We get in a car. I wanted to be a driver. So I think as a really little kid, I didn't have a concrete idea. But as I got older, I was really attracted to books. I read a lot as a kid. So I would say going through middle school and early high school, I wanted to be a journalist. And I was on the way to being a journalist. Participating in the newspaper. I did a lot of magazine work, debate. And then I guess I ultimately realized that while I like writing and observing, I wanted to take a more active role in the stories that I encountered. So that led me a little bit away from writing. But I would say before medicine, my path was to be a journalist.
What is your biggest failure in life, and what did you learn from it?
Actually, this question is hard to answer because without having failed or without anything that has happened, I wouldn't be here today. So it's hard to think of it as a failure, actually. Let me think.
It's a good way to look at it. And that's part of the reason why I asked the question, because people don't realize that failure is a good thing because it makes you stronger. You learn from it.
Mm-hmm. This is a silly thing, but back in high school, I remember to get on the journalism staff, you have to take a preparatory course, and then they interview and choose the staff for the newspaper. And I had done fairly well in the course, and for some reason, the first round, I didn't get chosen to be on the staff. And that actually jumps out in my mind as something that was totally unexpected, and I was young, and I didn't really know how to make sense of that. And so then and then I became a TA actually for the preparatory class, and I took it again, and then I applied again. And from there, the second time I got on staff and became an editor, and that was a really important part of my high school experience. And I think what I learned about patience. When things don't happen the way that you envisioned, usually there is a reason. And usually I've learned more from those experiences. So being a TA for that second time around, I learned more about the background, the back end of the newspaper, how it works from the advisors and the teachers' perspective. And I think that really helped me later to be on the staff and, run my section. So yeah, I think as early as that, every time something similar has happened, I've learned to look for the lesson, and there's always a lesson.
What is your biggest success?
Oh, gosh.
Or what is the first success that comes to mind?
I would say, from where I'm standing now, I think turning residency and what I've learned into a project that I'm passionate about, that something that I feel inspired by. And I guess the success is to, again, look for the lesson. And that even when things don't, residency is not a fun experience for anybody. But in those times, staying true to looking for the thing you're passionate about and not settling for something that, doesn't inspire, I think that would be what I consider success. Just staying true to your vision.
I'm guessing your journalist background had something to do with this, but what made you start Ask Dr. Amy, which is a blog and some video, it's a YouTube channel essentially, where you provide answers from your pediatrician. And as you say, you discuss everything you can't get into the 10-minute visit. What made you start that, and where is that now?
That's a really good point, that maybe the writing part had to do with it, but I think more immediately the influence that led me to that was working for Khan Academy. In medical school, there was a contest for video making, and then I got recruited to be one of the medical content makers on Khan Academy. So that was a lot of my training in how to make a video, how to explain things. And then, so that was the technical aspect. But then, yeah, you're right, the actual inspiration for the video or the channel is because I think medicine is very narrative science. It's based on, clinical basic science, but it comes down to the story. And a lot of times we lose the story in how we do the medicine. So given the time constraints of clinic, I found that, I didn't have time to explain things to patients the way I wanted, which is with the amount of depth or detail. And I was trying to explain the same thing over and over, but not in a good way because I didn't have enough time. So I thought, taking what Khan Academy taught me, the way people learn best is at their own pace, with a video that's 10 minutes or shorter that they could watch over and over, and effectively teaching them. And I think pediatrics is so education heavy that a lot of times we go to the pediatrician not because there's a problem, but we just want to ask a question. So I started the video as a way to explain things better, make it more efficient for people to access, and also because I didn't find any good material out there right now. Like, you do a good search for what to do when my kid has a fever, you get a lot of different things, and it's hard to know what to trust. So I wanted to, from a clinical perspective, exactly what we would tell you in clinic, put it in a video and make it accessible to people. So the channel is still live, but now that I'm working on my new kinder company, that I think those two will dovetail, and people can access the videos either on YouTube or on my website. And I hope to keep making those. I mean, there's an unlimited number of topics for parents to ask questions about.
Well, you mentioned kinder. Let's go into that. So from what I understand from our last conversation, it's a pediatric telemedicine company, but there's also a community component. I've heard of telemedicine companies popping up left and right, but what I want to know is, what is this community component, and what makes this company different from all the other telemedicine companies?
Great. So I would say it's the first virtual primary care clinic. And that's really the big difference that answers all those questions, is that the majority of telemedicine or virtual care companies out there, like American Well, MT Live, Teladoc, even Pediatric Associates, that's the pediatric part, they're all urgent care style. So you've never seen this doctor before. They don't know anything about you. And in a flat fee video, we talk about the problem that I had today. And I've actually used that for adults. It works great. If you have a sore throat or something, quick and easy. I think pediatrics requires a different kind of continuity with their doctor. So kinder is really a primary care style clinic, which is ownership of the patient and mutual ownership of the pediatrician as well by the family from the very beginning. And instead of just urgent care things that pop up, we'll also do the well child check components, the way we do it in clinic today. So I think that's a big difference, is primary care versus the urgent care. I think the community goes out of that because, my members in my clinic will be a community. And on the website, I'm setting up a forum where they can talk to each other, talk to me. And I'm really going for the continuity of care aspect, which I think is an underutilized potential of virtual health. We all know how fast and efficient it can be, but if we apply that to a continuous relationship, I think the mobility of it and the ability for you to build a lifelong relationship is even more interesting. So that's the community part.
Why did you start this company?
I think residency is an interesting experience. I learned a lot, obviously clinically, but I also saw how our system is just not efficient. I think we're doing things the way that we've always done them and not thinking about what's the best way to do this. So I just thought there was a lot of waste in the way we do the practice in terms of people's time, but also just inefficient access. I've met too many patients who told me, the pediatrician's office was closed. That's why we came to the ER. We couldn't reach the pediatrician last night, so we did this. And I don't want patients to have that experience. I think it's, the ownership of the patient is not possible without changing the way we communicate. So the communication part was the first part. And then I started looking into virtual health. And from there, really, like you said, from the video, it made me start to think, okay, if we can communicate better, what does it look like if the patient can reach me at all times of the day? And then what kind of relationship and partnership can we have from there? So that just evolved. And I think the timing's interesting. I think 5 years ago, it wouldn't have been possible. The policy, the technology, the generation of people who might be generation of parents who might be interested in this. It's all coming together in an interesting timing. So yeah, the basic bottom line is I just thought there's a better way we can do everything that we do. The fact that you can't take a picture of something, send it to your doctor, which at some points you can now, but the more we explore these options, the more the in-person part, the inefficient part, is not necessary anymore. So that led me to think, okay, let's get rid of the parts that we don't need and just focus on making the relationship better.
Let's talk about something similar in nature, and that is the broken patient-doctor relationship. Mm-hmm. And as you say, it's getting a lot of attention. And as you also say, rightfully so. To quote you, it is the visible above water part of the iceberg that is our broken healthcare system. So Amy, what is the only real way to fix the patient-doctor relationship?
I think it's to give agency back to the two populations that matter. And you can almost argue they're the only two populations that matter in a healthcare system, which are the patients and the providers. And, that's the above water part. You see that interaction and there's all these problems with it. But those two groups don't have agency, meaning they don't have the ability to change how they interact. The patients play a pretty passive role. They historically have been, because the system doesn't allow them to, from anything from choosing their doctor to being empowered by knowing more about what's happening to them and really getting educated. And the provider part do a lot of things to make sure we get reimbursed and avoid lawsuits. And that's, again, not the physician's fault that sometimes you have to practice in a way that doesn't make sense. And the burden of, not being able to interact and talk to your patients the way you want. So it seems like physicians have a lot of power in the healthcare system, but I would argue that they don't. And, the way we practice is just burdened by things that have nothing to do with that relationship. So I think the only way to fix that is to get rid of some of the clutter and bring those two groups closer to interacting, also giving them both more power to interact with each other.
Yeah, a fascinating thing or a related thing is, as you talk about this, I realize that I don't know my doctor's personal phone number. I don't even know his personal email. And
of course.
That probably isn't a good thing, right?
Yeah, and there's all these reasons, it's HIPAA, technically you shouldn't email. That's why these platforms giving you a HIPAA safe way to communicate is good. But also your doctor, given the way they have to practice and how many patients they have, it's perhaps not realistic for them to have every patient's cell phone number. But then should the system demand the primary care doctor to see 1,000 patients badly instead of seeing 200 patients really well? And which, we have the physician shortage, we have to think about the numbers. But at the end of the day, I would bet that your doctor probably would want to give you those information, be able to communicate with you, but they can't for all these reasons.
Yeah.
Yeah. But if I think it's, a broken system when people think of when you have an emergency, especially with a kid, it's the middle of the night, there really needs to be a better way for them to reach their doctor who's known this kid their whole life. And, without that component, the relationship will never be a true ownership.
Amy, what books would you recommend for the audience?
I think my favorite book is The Alchemist. I think everyone needs to read The Alchemist. I'm a fiction reader. I actually don't. I listen to nonfiction, but I read fiction. So I would say everybody needs to read that book. The book I'm reading right now is a book called The Storyteller. It's about an anthropologist in the Amazon. That just happens to be. I read a lot of books that have nothing to do with medicine. But on the medical nonfiction side, I think The Healing of America, I think the last name of the author is Reed, is a book everyone should read. And it compares our healthcare system to the other systems in the world, or I should say compare our system to that of the developed nations in the world. The business of it, the cost structure, the insurance side, what are the differences? And then why is ours so cost prohibitive, or how can we make it better compared to others? So that book taught me a lot, I think.
Yeah, that's a common theme from the guests on the show is recommending a book about how our healthcare system is just really expensive.
It is, and I think the other interesting part is not many people understand why it's so expensive. And I don't say that as if I am someone who does understand. I don't understand either, but I'm trying to learn about what are the different pieces that are, affecting each other that makes the whole system so expensive and costly. So yeah, I'm still learning. Yeah, I think, in the beginning, I'm not somebody who grew up being really into, a business and technology, but I've come to learn that without these two pieces, what it really affects at the end of the day is the patient-doctor relationship. So I've come to recognize the ecosystem and the fee structure and insurance behind that to be more and more important. And when we say, value-first reimbursement, that's really what I'm trying to create here is care that where we care about the ultimate value of the care and not how much we do. And so I think, I think doctors need to have a more active stake in creating that ecosystem because perhaps in the current structure, there's not much incentive to make it that way.
Amy, thank you so much for being a part of PedChat.
Thank you, Zach. Have a good day.